Hi, Dr. Djohan. You are live with Brave, all the way from Cleveland Clinic, Ohio. Thank you for making the time for us. I know you're a really busy doctor and doing a lot of great work there, but we'd love to talk to you about a couple of things. Being that you have a microsurgery background, we really want to focus on nipple sensation and techniques around it, and kind of what your take on is that as a woman obviously doesn't want to lose their sensation in their nipples. And then a little bit about Brave to start out with, just so our viewers understand our relationship. But firstly, I just want to tell everybody that's watching or will see this on social media a little bit about you. You're obviously got a wonderful background with Chicago Medical School. You also went to Columbus St. Joseph for your general surgery. You did your reconstructive microsurgery fellowship at University of Chicago and cosmetic fellowship at the Cleveland Clinic. You are now vice chair of the plastic surgery department and section head, most importantly, around breast reconstruction, which is what we focus on. And that's why you're what we call a subject matter expert. So with that, thank you. And I'll just say, we met Dr. Djohan many years ago. I worked in the industry and no longer am working in the industry, just working on Brave. And Brave stands for Breast Restoration Advocacy and Education. We don't force reconstruction on anybody. We just want women to know of their options around restorative procedures that Dr. Djohan is an expert on. So we've been doing this for about 9 years. Dr. Djohan agreed to be a Brave doctor, and Brave every year is March 21st. And it was right in the middle of the COVID virus. In fact, we sent him his little Brave surgical cap to wear, but now had I known, I would have been doing surgical masks. So I was a little behind the curve. So not a good time for Brave, but nonetheless, thank you, Dr. Djohan. I'd love to talk to you about techniques and nipple sensation.
Yeah. So thank you, Christine. Thank you for the Brave group in trying to introduce me, and also trying to communicate to all the patients who had breast cancers or undergoing breast cancer treatment. Certainly, this is a program for making patient awareness. And there is not only trying to restore the breast shape as well as putting the breast back together after the mastectomy, but a lot of patients do not realize that with mastectomy, they remove the breast cancer and the breast tissue along with the nerve. And therefore, that after the reconstructions, without reconnecting the nerve, a lot of patients will have this sensory lagging, or the recovery process may not be up to the point where they feel okay. And it was actually popularized by made awareness by the New York Times article about a year or two ago, that patients with new breasts, they feel numb and they are not expected about that. And therefore stimulate us in trying to do innovative and in fact in trying to help these patients in trying to restore the sensations. Certainly, first of all, during the mastectomy, we work along with the breast surgeons in how to preserve the nerve. We can locate them. We did a lot of cadaver dissections and a lot of research, and we actually published that, and has been cited by many articles about where are these nerves are located. And we're trying to teach all the other surgeons and how to do this nerve preservation of the nipple-sparing mastectomy. And after that, how do we reconstruct them? So when patients undergoing the breast reconstruction with tissue from the abdomen, we also locate those nerves from the abdomen, where we take the tissue for the deep flap procedures, and we reconnect those two nerves together. Sometimes we utilize a nerve allograft to reconnect the nerve. And the implant-based reconstruction, we started also to reconnect the nerve that was preserved with the nipple-sparing mastectomy in connecting it to the nipple itself. So with our early research result in showing that very promising outcome, when we compare to patients who do not have the nerve neurotization process, they actually have a better sensory recovery process. So this is very, very exciting. And certainly, we certainly would like to make sure patients aware this is a new type of reconstructions that they have a choice to. Unfortunately, not all of the medical insurance recognizing that yet. So hopefully, with more and more publications, they would consider that this is becoming a future standard for the reconstructions.
So right now you have that one publication, which I'll put that on our website. I'll post that when we're done if you send me the link, so people, even if it's patients and they take that and bring it to their surgeon, maybe they can kind of encourage this. And it sounds to me you can either take the nerve itself with the flap or use this cadaver-like product for nerve graft, so the woman doesn't even need to take the nerve from her flap. Is that correct?
No, sometimes even you take the nerve from the flap, there's still a gap, a missing area that you need to bridge the nerve stumps. But the first important stuff is that we have to locate those nerve endings so that we can bridge the gap, so to restore them. That is certainly a learning curve for the surgeons. That's why it's our duty and to not only make patient awareness, but also to teach other surgeons that these are techniques that are reproducible and then providing a good outcome.
So, Mike, my thought, and I'm not trying to lead you on this one, but you are trained as a microsurgeon, and I think patients in general, they don't know board certified plastic surgeon versus not. So step one is a board certified plastic surgeon, and then if you have to have some sort of any kind of nerve repair, microsurgery is very important, right?
Yeah. Usually it is true, but so we'll see how it is actually catching on with the whole Society of Plastic Surgery. And in their training, they have some degree of training to do it. But early, that will remain to be seen about the attractiveness and then adaptability to the surgeons.
That's really helpful, because what I had actually a patient about a month ago call, and what Brave is, we have medical advisors, but we're not doctors, and we just always send them to people like you. And the woman was on the East Coast, and the doctor was not a microsurgeon, and he was just going to take her nipples off. And I don't understand medicine like you do, Dr. Djohan, but the cancer wasn't near the nipple. So we sent her to a microsurgeon, and he did exactly what you just described, and she has nipples, and that was really important to her. So maybe it's not important to all women you deal with, but if it is,
Yeah, at least we attempt to try our best to restore the sensory recovery process and help the patients to recover from the mastectomy and potential getting the feeling back.
Yeah, and I know that I think the company that makes this product, and we don't try to sell to anybody. We just try to let patients understand what's out there. I think Oxygen is one company. Is there any other company, or is just Oxygen doing it right now?
Currently, the one that is well known and having the proprietary is Oxygen.
Okay.
Certainly, there have been some other interest in other companies developing it as well.
What our job is Brave, is really just to help you with the insurance component, which you talked about. So obviously, as you build up your science and evidence-based medicine, maybe that'll help. But in the meantime, I think if Brave could partner with you and other doctors to really talk about the insurance component, because if the patient can't have the insurance cover it, then you really can't do the surgery, correct?
Yes, that's correct.
Well, I know you're doing wonderful things. Thank you for the talk on that. We'll send out the data you have. And then just maybe pivoting a tiny bit, since we're in the middle of COVID. First of all, how are you faring at the Cleveland Clinic? Things coming back to normal soon? I know that reconstruction is mainly thought of as elective. So how are you doing?
That's correct. So we actually have been continuing to do the patients who have active cancers that would like to have reconstructions immediately. We actually, since we are doing the same PPE and we're trying to minimize the wastings and everything like that, and we provide the care for the patients with active cancers. So now we are doing the secondary steps for follow-up reconstructions, and we're lucky in Ohio that the surge is actually, hopefully, it's calming down, and we're thinking about starting to reopen again. And certainly we have to be very cautious regarding how to proceed, and then certainly we'll test the patients prior to the surgeries, and then communicating potential risks involved with having surgery and getting the COVID. And certainly we'll do our best to communicate, making sure patient awareness, and we help them to complete their reconstruction.
And so you're testing all the patients prior to COVID, for COVID? Okay.
Yes.
That's excellent. One doctor yesterday was interesting, Dr. Zen out of North Carolina. He said he practiced back during the AIDS epidemic really surged, which you're probably too young even to remember that. But he said that they used universal precautions if someone had AIDS or if they didn't even know. So he said he's doing the same thing now with COVID, like universal precautions, assuming we all have COVID. So I thought that was interesting.
Yes.
So, well, Dr. Djohan, I know you're probably a lot of patients to talk to this evening. We try to keep these 10 to 11 minutes. We'd love to have you on again, but I think as we get patients have questions about nipple sensation, I think it's a new hot topic. I think the insurers have not even sometimes wanted to pay for breast reconstruction. So we just have to kind of fight the battle and be brave and keep helping women get what they need. And since you're such a key opinion leader in this space, we cannot thank you enough for helping women.
Yeah, thank you very much. I certainly thank you for your team in helping all of the patients who need your help.
We'll stay in touch. Thank you. Bye.
Okay, bye.